Thank you for joining this morning. My name is Carla Stevenson. I'm the Director of Internal Communications for UC Davis Health, and we are here this morning to do a virtual open house for the new Point West Clinic. So it is my pleasure at this point to introduce our Vice Chancellor, Dr. David Lubarsky, to give some opening remarks.
Thank you, Carla, very much, and thank everybody for joining. This is really a great opportunity because this is not about COVID for a change, which is a great thing. And it's about UC Davis Health's life after COVID. And talking about this truly is a joy, especially on Doctor's Day. The formal name of 1535 River Park Drive, where our in the Arden Mall area, is the UC Davis Health Specialty Clinics Point West. And it's very exciting because, we really haven't been doing or focused tremendously on the things that, really matter to patients who are not acutely ill, right? We've just been sort of plugging along. And so this is a real leap in terms of the facilities that we're able to bring to bear for our patients who need us for essential services that may not be life-threatening, but are nonetheless life-sustaining. So on February 24th, we began physical medicine and rehabilitation outpatient therapies. And on March 16th, we added our orthopedic physicians and integrative medicine, the first integrative medicine clinic with full services in this organization. It's been a long time coming, and again, is what our patients need and want in order to live a full and joyous life after an injury. The clinic itself is a 30,000 square foot building with plenty of space for our physical therapists who had to relocate out of our ambulatory care clinic on the main campus because of our construction projects. And this new facility is much better equipped. It has state-of-the-art equipment, a larger pediatric gym, which we were lacking, excellent and much more welcoming treatment areas. I know because I was a patient of our great physical therapists, and they took great care of me, but it wasn't a state-of-the-art facility. And now they have that, as well as an occupational therapy training apartment. So this really does complement all the great work that we do in trauma and orthopedics and physical medicine and rehabilitation with facilities that are really special. So I'm going to just say that this is great. It's great to be able to talk about how we're advancing care using our team-based approach to medicine and making sure that everybody, from the time that they need us to the time they return to as full a life as they are capable of leading, we're helping them get there with this type of clinic. I'm going to turn this over to Mike Condren, who has done an amazing job in refocusing our organization on providing state-of-the-art ambulatory care in state-of-the-art facilities with state-of-the-art medical providers. Our Chief Operating Officer for Ambulatory Care, Mr. Michael Condren.
Oh, thank you very much, Dr. Lubarsky, and thanks for your incredible, consistent support of ambulatory expansion. That's what's made this vision and this clinic opening today possible. So thank you very much. This is our fourth key ambulatory facility opening within the last 6 months, preceded by our new patient contact center in October, our Davis campus clinic in December, and our Roseville clinic in January. So this is really a historic period of expansion of ambulatory services and bringing services closer to where patients live and work. So really exciting. And Point West is exciting for a number of very specific reasons. As Dr. Lubarsky mentioned, this is our new home for physical therapy, occupational therapy, speech therapy, and the related services offered in that clinic. The team really had the opportunity to design this facility to meet the needs of their patients in a way that they just couldn't do in the ambulatory care center. So it's bright, it's open, it's airy. I think the staff have a spring in their step with this transition, and their patients feel it. And it's really an exciting time for the therapies program. So congratulations to all. I'd like to recognize Sean Sumner, our outpatient manager, and Ann Tompkins, our director of rehabilitation services, You've just done an incredible job with this facility, and it's very exciting to see it come to fruition. On the second floor, we've got a lot of exciting offerings, and Dr. Levarsky mentioned the integrative medicine program. This has been a hole in our outpatient offerings for many years, and BJ Lagunde, our executive director, Denise Nishio, our former associate medical director, Anka Knopfler, and many others have championed the need to bring an integrative medicine program to UC Davis Health to fill this incredible need that our patients have for these services. We'll be offering integrative medicine primary care, consultative care, massage, acupuncture, nutrition services, meditation, stress management, and resilience training. And we'll continue to build on that foundation over the upcoming years. So really exciting for our patients, and it's been a long time in the planning. So that's a big part of the second floor clinic at Point West. In addition, we have a number of specialty services already planned and with room to grow. So we've got orthopedic surgery, physical medicine and rehabilitation clinic, hand surgery, urology, and again, room to grow over the years to accommodate a true multi-specialty vision at Point West. I'd like to recognize Shameen Khan, our great practice manager over the Integrative Medicine and Specialties Clinic at Point West, and hand the floor back over to Carla to see a short virtual tour of the clinic itself.
Of course, there's technical difficulties with the video.
Well, while we're talking about while we're working through those technical difficulties, I do want to note that it is Doctor's Day today. And it is appropriate to recognize that how hard our teams have worked inside and outside the hospital to keep our patients safe, to keep our colleagues each safe, and the employees and the teams that they work with safe, and have really worked overtime and incredibly hard on behalf of people who really needed them, right? I mean, our acuity of our organization went up, patients we were treating tremendously over the last year because we were seen as a resource for those tremendously afflicted, not only by COVID-19, but by delayed care and by, worsened strokes and worsened heart attacks and things that might have been a little easier to treat were COVID-19 not part of our last year of existence. So I know how hard they've been working. I know that this is talking about outpatient right now, but in the outpatient arena also, right? Coming to work every single day and facing the idea that they might be exposed to COVID-19 and not really having a full understanding of what that meant, but still soldiering on and coming to work every day and taking care of people as befits their oath as a physician. I'm just incredibly proud of every single one of them. And it doesn't matter whether they were treating COVID patients or someone who might be carrying COVID. They put themselves at risk for us. And I'm eternally grateful because they made UC Davis, again, stand out in this region as a real asset for the people, right? All the people, right? Near and far, who got care here. How we doing, Carla?
I think we have it here, so.
Okay,
Thank you,
I'll
everyone.
shut up then.
Welcome to our new Point West Clinic.
So the clinic is going to consist of family medicine, internal medicine, integrative medicine. We also have orthopedics, sports medicine, PM&R, and we also have acupuncturist in here.
The first floor here is really dedicated to therapies, and so that's our physical medicine and rehabilitation therapies area. We're really looking to create our flagship therapies unit. We were able to design this space ourselves for state-of-the-art equipment for orthopedic and neurological conditions that come here for therapies. We have lots of different types of therapies here, including neuropsych testing, physical therapy, occupational therapy, speech therapy. There's a ton of natural light. We have a lot of windows in the therapy gyms. In different rooms, we have lighting set up so that we can alter the lights for moods. In our pediatric area, we actually have an entirely new gym area, which is much expanded from the services that we had before. We have an area for our pediatric physical therapy team, a pediatric occupational therapy team, our pediatric speech therapy, and neuropsych, all different services to be able to be in this brand new pediatric gym and pediatric facility. We have a wonderful new occupational therapy training apartment. This allows for people to come in and practice their activities of daily living using equipment they would have in home so that they can actually practice on the things they're going to be using in home and be successful as they transition more back to an independent living. And the second floor of the clinic is our Point West Clinic, which is dedicated to our physicians and the physician staff up here to be able to see patients for their ongoing needs. We've made a very concerted effort to have the art feature local artists, but also to have a feeling of warmth and to help with that overall patient experience as they come into the clinic.
Our patients are our primary focus. We want them to feel like they're at home. They're like, they feel they're respected. They're treated with courtesy and respect. And the goal is to make sure that we provide them with the same level of care they deserve.
The reaction has been so far overwhelmingly positive. People love to see all of the new equipment that we have, but also being able to interact with the therapists that they've had in the past, so they still get that same great team, but also get the experience of having this new facility.
Well, Carla, great video. You really captured the essence of the building. And then thank you to Sean and Xiaoming. Wonderful job. It's really going to be an incredible place for our patients to receive care and for our physicians and staff to work. So thank you. I'd like to take a moment to recognize some of the individuals that were instrumental in making this clinic happen, starting with Mario Solis, our incredible project manager on the team, on the project at Point West, and the entire facilities team, Keith Konda, Brett Mitchell, and the entire group. Thank you. How you all kept this on track through COVID is truly amazing. So thank you for all of your work. That includes our partners, Boulder Design Team and SB James, our construction partners. Thank you. IT, I'm thanking you always, Lori, Matt, and the entire IT team and each of the disciplines that are involved in pulling this off and making this happen, despite so many other commitments. So thank you. Our public affairs and marketing partners, thank you. Many of the leaders involved, Xiaoming, Sean, Ann, Dave Del Pizzo in imaging, Will Gilliland, our facilities manager, BJ Lagunde, our executive director in ambulatory, and really everyone involved in this effort. Thank you. It's really going to be wonderful to see patients heal in this environment and for our staff and physicians to thrive. So I'll echo Dr. Lubarsky's sentiments on Happy Doctors Day to the doctors on the call. Thank you for all you do every day. And with that, thank you one more time, Dr. Lubarsky, for your vision for ambulatory services at UC Davis Health. And let me hand it back to you for closing remarks.
Sure. Well, I just want to thank the team. And like I said, I've been a personal recipient of care in the old ACC facility, and I am just so happy that we're going to be treating patients in this state-of-the-art facility. It is going to be a wonderful step-down link, if you will, to our new rehab hospital, which we're going to be breaking ground on shortly, which will opening its doors in a couple of years with the same type of light-filled and joyous treatment spaces that make for a better healing environment. And so this is part of the continuum of care, which makes us into a true health system, right? Which from the moment you step foot into our organization till the time that you are back and fully functional at home, we're there by your side all the time. And I'm glad that we're able to deliver a facility like this so that our great professionals can just provide great care and great service in a great location. So thank you all for all the hard work that you do, each and every single one of you. And I will look forward to actually visiting the clinic as a patient. Well, no, I won't actually look forward to visiting the clinic as a patient, but if I need to do that again, I will look forward to being in a really nice environment. So again, thank you to everyone.